Hi, Paul Sackett's Good News Broadcast, speaking to Dr. Michael Richman. Hi, doctor. How are you?
Hi, how are you?
Okay, WebMD cholesterol expert, and you also board-certified cardiothoracic surgeon, CEO of the Center for Cholesterol Management. Okay, what is cholesterol?
Cholesterol is an oily, waxy substance that we need in our body. You know, all cells use it. We manufacture hormones from it, but it also does bad things. It clogs arteries.
Okay, and it does that by how does that happen?
Well, basically, you know, to make it simple, is blood is a water. So, like vinegar, for example, and cholesterol is an oil. And oil and vinegar salad dressing we know doesn't mix. So somehow you got to carry the cholesterol through the blood, and what the body does is it packages it. It puts these in these particles which allow it to flow through the blood and get to where we need it and get to where we don't need it. So these particles then actually travel through the wall of the artery and then lay down the cholesterol, and it narrows the artery. So it's the analogy is cars on a freeway. It's the number of cars which cause a traffic jam, not the people in the cars. And what we do in the real world now mostly is we do regular traditional cholesterol testing where we measure the people in the cars, not the cars. And as I said, if you got to drive the cholesterol around, and the cars are actually what drives it into the wall. So we need to know how many cars there are.
You make a good teacher.
Thank you.
There's good cholesterol, and they say these words: good cholesterol, and they say there's bad cholesterol. Why do they say that?
Well, HDL cholesterol is the good cholesterol, and LDL is the bad cholesterol. That's just the way it is. And as I said, all cells need cholesterol. But once again, the good cholesterol is carried in these particles. So in other words, HDL cholesterol is carried in HDL particles, and the bad cholesterol, LDL cholesterol, is carried in LDL particles. So we need to have a test to identify these particles, and fortunately we do. It's called the NMR LipoProfile, and it's a way of actually drawing the blood and doing an MRI essentially on the blood and measuring these number of particles or these number of cars. And the more cars you have, the more lipoprotein particles you have, the greater your cardiovascular risk, and that's borne out in numerous studies.
Okay. Now, someone had mentioned to me something called triglycerides. What are those?
Triglycerides are fats, saturated fats, and once again, you know, we do need those in our body, but people who are diabetics or who have so-called insulin resistance, you know, people who are apple-shaped, are not able to handle these fats. And people who have triglycerides, high triglycerides, actually, most people have a low good cholesterol, and that's a warning sign that these people are insulin resistant or have what's called the metabolic syndrome. It's pre-diabetes, essentially, and they have too many of these particles, too many of these cars. And like I said, the cars, and this is so hard to teach people, the cars are what drives the cholesterol into the artery wall and causes narrowing of the arteries or atherosclerosis.
Okay, it's good to get the triglycerides checked as well, right?
Oh, absolutely,
okay.
Absolutely.
You have a lipidcenter.com. Tell us about that. I know we only have a minute or so left. Or anything else you want to tell us that you think we should know right now?
Well, I absolutely recommend that patients and physicians go to my website. I'm selling nothing other than education, and click on the patient section, or there's a professional section, and learn about the different testing and how cholesterol is transported in the body and how to treat it, lifestyle changes including weight loss and smoking cessation, and diet, and then learn about medicines. And I think it's important to be an educated consumer to be able to approach your doctor with a knowledge base. And that's why I would recommend that people go to lipidcenter.com and just start learning.
Last night we did a show with the Women's Day Red Dress Awards about, you know, tons of women in red dresses talking about heart.
Right.
Heart is number one concern, in essence, for women as well, right?
Number one killer of men and women. And for women, if you total up the next 7 causes of death, it doesn't add up to the number of people who die from cardiovascular disease.
So every woman should, in essence, know your number. Is that a good thing to say?
I think everybody should.
Okay, and then watch it. Regularly, how often?
Well, it's up to your physician. If it's normal, there's no set recommendations for doing lipoprotein testing, but I would tell people if it's normal, probably have a cholesterol test every year, every couple years. If it's abnormal and your doctor is doing an NMR LipoProfile, it's up to him or her how often to do it. Basically, if you're changing treatment, you want to know. But if not, I would say annually.
Okay, Doctor, you're doing a lot of good things. National Firefighters, a lot of good public service. Thanks for doing it.
Thank you. I appreciate it.
Take care. Bye-bye.
Okay.